This is the EKG review test. There are around 160 questions here that will assist you and guide you in preparing for the EKG test. And here we go. Question number 1. This cavity contains the heart and lungs, among other organs. C. Thoracic. The breastbone is referred to as the sternum. The pericardial sac that surrounds the heart allows the heart to contract and expand within the cavity with minimal friction. What are the 3 layers of the heart wall? Epicardium, myocardium, endocardium. Number 5. Which body plane divides the body into upper and lower portions? Transverse. Number 6. The atrioventricular valve between the left atrium and the left ventricle is the mitral valve. Number 7. The wall that separates the 2 superior chambers of the heart is called interatrial septum. Number 8, the heart valves that separate the atria from the ventricles are called the atrioventricular valves. Number 9, the skeleton of the heart separates the atria from the ventricles. Number 10, the heart receives most of its own blood supply via the coronary arteries. Number 11, this heart chamber delivers oxygen-rich blood to the ascending aorta, left ventricle. Regulation of the heart speed, rate speed of electrical conduction, and strength of contraction are influenced by the brain via the blank nervous system, the autonomic nervous system. 13, the cardio accelerator center is located in the cortex of the brain. Number 14, the most muscular chamber of the heart forces blood through the aortic valve into the aorta, would be the left ventricle. Blood returns to the heart from the lungs via 4 blood vessels called pulmonary veins. 16, how many chambers are there in the human heart? 4 chambers. Number 17, blood travels to the lungs where carbon dioxide is unloaded and oxygen is loaded. The blood vessels that carry the blood from the heart to the lungs are pulmonary arteries. Number 18, during which phase of the cardiac cycle do the coronary arteries fill? Early diastole. 19, this heart chamber receives blood from the systemic system, right atrium. 20, how much of the blood coming into the ventricles flows passively through the atria? 70%. 21, which of the following is the first structure that will be seen when imaging from the suprasternal notch, aortic arch? 22, which one of the following tests does not permit the calculation of the cardiac ejection fraction? Chest X-ray. 23, the contraction phase of the heartbeat is called systole. What is the middle layer of the heart responsible for pumping action? The myocardium. 25. What is the innermost layer of the heart? The endocardium. 26. The amount of blood flow to the myocardium is termed perfusion. 27. What is the top layer of the heart? Epicardium. 28. The most superficial layer of the heart, the top layer of the heart, that is made up of squamous epithelial tissue over loose areolar connective tissue is called the epicardium. The three-leaflet heart valve located between the right atrium and ventricle is referred to as the tricuspid valve. When you are facing someone in normal anatomical position, at which body plane are you looking? Frontal. 31. The term distal means farthest from the point of attachment. 32. What position is the patient placed in for the EKG? Supine. Which body plane divides the body into equal portions? Mid-sagittal. What is the medical term used for surgical incision into a blood vessel? Angiotomy. 35. The blood vessel that carries oxygenated blood from the left ventricle through the body is the aorta. 36. During the depolarization, impulses are generated and transmitted when positively charged ions move inside the cell, causing the interior to become positively charged. 37. As an impulse moves toward a positive electrode, it produces what type of deflection? Upward deflection. One complete heartbeat, known as a full cardiac cycle, lasts approximately 0.8 seconds. Ability of the heart cells to receive and transmit an electrical impulse. Conductivity. Which of the following refers to the period in which the mechanical and electrical events of the heart are relaxed and involves repolarization? Diastole. An electrical current that initiates the contraction of the heart muscle, depolarization. 42. Branches off the bundle of his that conduct impulses to the left and right ventricle, bundle branches. The SA is the pacemaker of the heart. The SA, sinoatrial node. 44. Delays the electrical conduction through the heart, AV node. 45. The initiation of the impulse in the SA node and its movement through the atria produces P wave. The P wave on the ECG strip should be upright deflection and in front of the QRS complex. 47. Tall and symmetrically peaked P waves may be seen with increased right atrial pressure and right atrial dilation. 48. The normal QRS complex has a duration of 0.06 to 0.12 seconds. The Q wave is the first negative deflection following the P wave. 50. The point at which the QRS complex meets the ST segment is called the J point. 51. The QRS wave on an ECG reflects ventricular heart depolarization. In which of the following will the QRS complex have higher amplitude? The precordial leads. In leads 1, 2, 3, AVF, and V4 to V6, the deflection of the QRS complex is characteristically upright. 54. The QRS complexes appear normal if the rhythm is initiated from the SA node atria or AV junction. 55. P waves resulting from impulses that originate outside the SA node are called P prime. With ECG paper, five small squares, which make up a larger box, represent 0.2 seconds in duration. 57. On EKG paper horizontal measurements, are used to determine the heart rate. 58. Each small square running horizontally represent 0.04 seconds. What is used as reference point to identify the changing electrical amplitude, isoelectric line? When a rhythm speeds up and slows down in a rhythmic fashion, it is referred to as patterned irregularity. Which of the following terms means there is no consistency to the rhythm, such as atrial fibrillation? Irregularly irregular. 62. The most accurate way to measure heart rate is 1500 method, 1500 method. The 1500 method most accurate count the small boxes between the RR interval and divide 1500 by that number. 63. You should count the P waves to get the atrial rate. 64. The universal standard speed for recording an ECG is 25 millimeter per second. 25 mm per second. Which of the following is used to mark the ECG paper? A stylus. 66. Calibration mark is 10 mm, 2 squares high, 10 millimeters, 2 squares high. The use of non-invasive and painless ultrasound to examine the heart, its chambers and valves is known as echocardiography. Echocardiography. 68. Waveforms may be displayed on a screen called an oscilloscope. 69. To view the limb leads, we place electrodes on the right arm, RA, left arm, LA, and left leg, LL. With lead 2, the positive electrode is positioned on the left leg. Which ECG lead is considered bipolar? 2. 72. How many electrodes are used as part of a 12 lead ECG? 10. Which ECG limb lead does not record any electrical activity from the heart? Right leg. 74. In LEDs 1 to AVF and V2 through V6, the deflection of the P wave is characteristically C upright. If the patient has a lot of hair on the chest, it is necessary to shave it before placing the electrodes. What should be done before shaving it? Ask the patient's permission before shaving it. What instructions should be given to the patient before doing the electro? Remove any metal items, change and cell phones from their pockets and body. The ECG should be performed in a quiet environment because interference is minimized. Which of the following topics should not be brought up in exam prep? Insurance. What can prevent electrodes from being placed in their usual locations? Amputations, casts, or wounds. If a patient has a limb amputated, where would the electrode be placed? Tape the electrode to the site of the amputation. 81. Select the method of preparation for the patient that will ensure a successful ECG recording. Make sure the patient's legs are not crossed and the arms are resting at each side. 82. Where are the LL and RL leads placed on a patient whose legs have been amputated? On either side of the lower abdomen. What can a technician identify the intercostal spaces when placing the chest electrodes? Locate the sternum and feel for a dip at the edge. Which correctly identifies the 5 steps of analyzing an ECG in the correct order? Heart rate. 2. Regularity rhythm. 3 P waves, 4 QRS complex, and 5 PR interval. 85. The average normal heart rate is 72 beats per minute. What sinus rhythm has a rate of less than 60 beats per minute? Sinus bradycardia. What sinus rhythm has a rate of more than 100 beats per minute? Sinus tachycardia. 88. The term dysrhythmia means the ECG rhythm differs from normal sinus rhythm. 89. Characteristics of sinus rhythm include a rate of between 60 and 100 beats per minute. 90. Which of the following characterizes a heart rate of 70 BPM and an irregular rhythm? Sinus arrhythmia. Junctional tachycardia has PR intervals less than 0.12 seconds. Characteristics of idioventricular rhythm include a heart rate between 20 and 40 beats per minute. Which of the following terms refers to a ventricular ectopic rhythm with a rapid and regular rate greater than 100 beats per minute? Ventricular tachycardia. Which of the following terms refers to an early impulse beginning in either ventricle? Premature ventricular contraction. Number 95. Premature atrial complexes originate from the atria. 96. An R on T PVC occurs on or near the T wave of the previous beat. 97. Characteristics of premature ventricular complexes include that they have a wide and bizarre QRS complex. 2 PVCs in a row are called a couplet. 99. Which of the following terms is associated with the sudden onset of an ectopic atrial focus with a heartbeat between 150 to 200 beats per minute? Supraventricular tachycardia. 100. When monitoring a patient with a sinus arrhythmia, a gradual increasing of the heart rate is usually associated with inspiration. 101. The PR intervals may vary from beat to beat in wandering atrial pacemaker. 102. If a patient is said to be on asystole, characteristics would be described as rate of 0 and no pulse. 103. Pre-excitation produces a characteristically abnormal slurring at the onset of the QRS complex and a short PR interval. 104. Shorter than normal PR intervals may be seen in junctional escape rhythm. 105. Which of the following dysrhythmias arise from ventricles? Idioventricular rhythm. 106. Atrial fibrillation has no P waves. 107. Which of the following describes the PR intervals on second-degree AV heart block type 1? Progressively longer. 108. What is the following rhythm? Ventricular tachycardia. 109. Identify the following rhythm. Ventricular fibrillation. Note, fibrillation, VFib, is considered the most severe EKG irregularity. It is the most common form of cardiac arrest. 110. Identify the arrhythmia shown on the following EKG. First-degree heart block. Identify the following rhythm. Atrial fibrillation. The patient is asymptomatic during the ECG recording and you notice normal sinus rhythm. What should you do? Continue recording. Marks on the ECG tracing caused by another source of activity are artifacts. Number 114, artifact is problematic because it can mimic life-threatening dysrhythmias. 115, you are obtaining an ECG using a 10-lead ECG machine. The patient accidentally coughs while the strip is running, causing an artifact on the strip. This can be identified as a somatic tremor. Number 116, when abnormalities show during a resting ECG, the physician may order an exercise ECG. Another name for this is stress test. 117, when preparing a patient to wear a Holter monitor, instruct the patient to depress the event marker for its significant symptoms. Number 118, what takes place as a result of myocardial infarction? A portion of the heart muscle dies. Which of the following is a non-invasive procedure? Cardiovascular stress. 120, what vital signs should not be taken if the patient confronts with chest pain? Weight. Which of the following should not be included when charting EKG procedure? Technician's initials. 122, the category of antihypertensive medications that will cause vasodilatation, block aldosterone secretion, and increase urine output is ACE inhibitors. Number 123, a medication that can be used as a local anesthetic as well as a first-line antiarrhythmic used to treat acute ventricular arrhythmia is xylocaine. 124, a patient regularly taking digoxin for heart failure. The patient is instructed to do which of the following? Check their pulse on a regular basis. 125, an over-the-counter medication that can be very effective as an antiplatelet is which of the following? Aspirin. How do the medications that are called statins work? They reduce the incidence of heart attack and death in patients with high cholesterol. Narcan is an opioid antagonistic medication. The treatment is given in what part of the body? In a muscle in the outer thigh. Which of the following are treated with hydrochlorothiazide? High blood as fluid retention. How can a patient treated with sublingual nitroglycerin for angina know that the drug has lost its strength? They will not feel tingling when they place the medication under their tongue. Note, the route of administration of nitroglycerin is sublingual. Nitroglycerin should not be used if a patient is also taking medication to treat erectile dysfunction. Abnormal ventricular wall motion that is reversible with nitroglycerin is associated with myocardial ischemia. The patient has a history of cardiovascular disease. Which of the following tests would not be used as a screening procedure? Colonoscopy. 132, match the prefix anesthesio to the term that matches its definition. Sensation, anesthesio, sensation. 133, the prefix gast/r means stomach. Note, endo within, exo outside, stat immediately, PRN as needed, NPO nothing by mouth, CRI cry cold, ASAP as soon as possible, hyper high, cardiomyopathy refers to damage to a layer of the heart muscle, cardiomegaly enlarged heart, cardiodynia pain associated with the heart, suffix dynia means pain. Number 134, what part of the patient medical history includes their lifestyle and health habits? Social history. When educating a patient about factors that increase the risk of atherosclerosis, include which of the following? High blood pressure and obesity. Number 136, the most suitable type of patient education material is written using language at a 6th grade reading level. 137, choose the patient education process that requires gathering information about the patient's present healthcare needs and abilities. Assessment. HIPAA contains 4 standards. Which standard was put in place to ensure confidentiality of oral, electronic, and written health information? Privacy rule. What is the compression to breathing ratio for adult CPR? 30:2. Number 140, which of the following actions is helpful in assisting patients with their needs? Keeping a list of community resources that can further assist the patient. Number 141, this is the scrubbing of instruments with special brushes and detergents to remove blood, mucus, etc. Sanitation. Sanitization. 142, this is the process that involves a soaking or wiping process and inhibits the activity of disease-causing organisms. Disinfection. 143, the process used for supplies that would come in contact with internal body tissue or an open wound. It involves the use of heat stem and an autoclave. Sterilization. 144, mitoprolol low pressure is an antihypertensive medication. 145, heparin is a blood thinner prescribed for atrial fibrillation. Atrial fibrillation occurs when electrical impulses come from multiple foci in the atrium. The heart rate in atrial fibrillation is irregular and fast. Signs and symptoms of atrial fibrillation: heart palpitations, chest pain, tachycardia with an irregular rhythm. Causes of atrial fibrillation: high blood pressure, heart attacks, coronary heart disease, etc. Number 147, the PR interval on a 2nd-degree AV heart block type 1 is progressively longer. 148, myocardial infarction, heart disease in which coronary arteries are blocked, and cell death. One of the most significant findings of a heart attack on an EKG tracing is ST segment elevation. In cardiac arrest, the heart stops beating and the circulation of blood ceases. Most of the time, PACs, premature atrial contraction, don't need treatment. 151, premature ventricular complexes have a wide QRS. 152, one small square equals 0.04 seconds. One large square equals 5 small squares, 0.20 seconds. 153, TIA, transient ischemic attack, is another name for mini strokes. When preparing a patient with fragile skin for telemetry monitoring, apply decreased pressure when abrading the skin. The first sound is produced by the closing of the atrioventricular valves, and the second sound is produced by the closing of the semilunar valves. 156. The ventricular function can be divided into 4 phases: isovolumic relaxation, ventricular filling, isovolumic contraction, and rapid ventricular ejection. Underwire bra can alter the results of the EKG. Pulmonary artery carries the blood away from the right ventricle to the lung. 159. Electrodes are placed on the patient's skin to detect the heart's electrical activity. Electrodes positions: V1, 4th intercostal space, right sternal border. V2, 4th intercostal space, left sternal border. V3, equidistant between V2 and V4. V4, 5th intercostal space, left mid-clavicular line. V5, 5th intercostal space, anterior axillary line. V6, 5th intercostal space, mid-axillary line. SA node is the part of the heart's electrical conduction system, triggers both atria to contract. Number 161, wandering baseline is an inconsistency in the baseline location on the EKG tracing, likely caused by poor lead contact or skin applications as lotion or cream. 162, interrupted baseline artifact called broken recording is a break in the tracing, usually caused by an electrical connection, interrupted or broken lead. Electrical conduction pathway SA node to AV node to bundle of HIS, Purkinje fiber. Here's a sample graph. P wave records atrial depolarization and contraction. Represent depolarization in the ventricle, Q wave, R wave, and S wave. QRS complex represents depolarization or contraction systole of the ventricle. T wave represents the repolarization, relaxing of the ventricles. U wave is visible in patients with hypokalemia. Here's a graph. Another graph, ventricular fibrillation, VF, atrial fibrillation. Ventricular tachycardia, fast rate more than 100. QRS wide, no P wave. R to R interval. Supraventricular tachycardia. PVC, premature ventricular. AC interference. Fragmented EKG. SA node is number 1. AV node is number 2. Bundle of HIS. Left bundle branch. Right bundle branch. This is the end. EKG review questions.